After collecting subjective and objective data, the next step is to identify abnormal cues and client strengths. We do this by clustering related data to determine significant patterns and abnormalities. As nurses, we must distinguish between opportunities to improve health, risks for mental health concerns, actual client concerns, and collaborative problems that require medical management. Let us now go through the process of identifying and clustering data to recognize patterns. Step 1. Identify abnormal findings. For example, a patient reports frequent forgetfulness, difficulty recalling names, and getting lost in familiar places. Step 2. Recognize client strengths. When a patient experiencing anxiety actively seeks counseling and support groups, which is a positive step toward mental well-being. Step 3. Cluster related data. For example, a combination of confusion, memory loss, and difficulty performing daily tasks may indicate early cognitive impairment or dementia. Step 4. Classify the concern. If a patient requests help for substance use, this is an opportunity to improve health. If a client has depression with suicidal thoughts, this is a risk for suicide. If a patient presents with anxiety due to memory loss, this is an actual client concern. If a patient has seizures related to brain injury, this is a collaborative problem requiring medical intervention. Some clients actively seek ways to improve their mental health. For example, when a 45-year-old patient states, "I think I drink too much and I want to quit," you may conclude the patient has an opportunity to improve health related to substance abuse treatment. For our nursing actions, we can provide education on treatment options, refer the client to support groups. For this case, example is Alcoholics Anonymous. Encourage motivational counseling and relapse prevention strategies. Patients who express a desire to change should be supported and encouraged to take proactive steps toward recovery. Some clients may be at risk for severe mental health issues. One risk could include risk for suicide. This is associated with depression, suicidal thoughts, lack of support, and loss of significant others. Example of this could be that 22-year-old college student who recently lost his parent and said, "I don't see the point in living anymore." Our nursing actions could include conducting a risk screening, and for this case, we can use the Suicide Risk Screening Modified SAD Persons Scale. We can engage mental health professionals for crisis intervention and ensure immediate safety measures such as monitoring and hospitalization if necessary. Risk for delayed growth and development. This is associated with living in a confined or unhealthy environment that limits activity and stimulation. Example is a 6-year-old in foster care displaying poor social skills and emotional regulation. We can refer the client to pediatric developmental specialists and promote early intervention programs to support cognitive and emotional growth. Early identification of risk factors allows for preventive interventions and better health outcomes. There are actual client concerns that require nursing intervention. Example could be anxiety related to memory loss. This could be presented by a 70-year-old client who frequently forgets appointments and says, "I'm afraid I'm losing my mind." As a nurse, we can offer reassurance and education on memory support strategies and assess for early signs of dementia. Confusion related to dementia or head injury. This could be a problem, especially for example, a 55-year-old patient who mixes up names, misplaces items, and has trouble concentrating and conversing. We can conduct the mini mental state exam and assess for neurological conditions such as stroke or traumatic brain injury. Identifying these concerns allow us early intervention and supportive care. Some mental health conditions require both nursing and medical management. These are known as collaborative problems. Common collaborative problems include stroke, increased risk due to hypertension or previous stroke history. Increased intracranial pressure. Symptoms could include severe headache, confusion, vomiting. Seizures. This may result from brain injury, epilepsy, or alcohol withdrawal. Meningitis. Symptoms could include stiff neck, fever, and altered mental status. Depression, persistent low mood, loss of interest, and social withdrawal. As nurses, we must monitor symptoms, prevent complications, and collaborate with primary healthcare providers. Some mental health symptoms require urgent medical referral. When to refer? Sudden memory loss, extreme confusion, rapid personality or behavior changes. Nursing actions could include documenting the symptoms, notifying the provider, and ensuring a safe environment. Referring clients for early evaluation can lead to timely diagnosis and treatment. In summary, Data clustering helps nurses distinguish between normal and abnormal mental status findings. Client concerns can range from mild anxiety to severe memory loss requiring medical intervention. Collaborative problems require monitoring and physician-led treatment. Sudden cognitive decline and severe confusion require immediate referral. By applying these skills, we will be able to make informed clinical decisions that improve patient outcome.